What actually happens inside our body when a heart attack occurs? Does it come suddenly just like that, or does it develop little by little? If you hear the story of my patient Richard Rowe, you will understand this clearly. I'm Dr. Joseph Gnanaraj, a cardiologist practicing in Waterbury, Connecticut, US. Richard Rowe and Peter Doe were close friends. 10 days ago, Peter Doe suddenly developed chest pain, but he neglected it, thinking this is just an ordinary pain, and did not go to the hospital. The next morning, sadly, he passed away in his sleep. When his wife came to check on him, he was no longer alive. Peter Doe's death completely shook Richard Rowe. It was around 10 o'clock that morning. He was sitting on the sofa watching TV. The TV was running, but what was running through Richard's mind were memories of Peter Doe. Why didn't he go to the hospital? He was filled with regret, thinking, oh no, if Peter Doe had gone to the hospital, he might have survived. In the midst of that worry, his blood pressure started to raise. That morning, Richard had not taken his blood pressure medication. He got up from the sofa and walked toward the medicine box to take his blood pressure medication. While walking, he felt a slight heaviness in his chest. As he continued walking, the heaviness increased, as if a huge elephant had come and sat on his chest. After taking his BP medication, he sat down on the chair nearby, but the chest pain was unbearable. Just like water droplets dripping from a plant after the rain has stopped, sweat poured down his entire body. The first warning sign of heart attack is often chest discomfort. It may feel like pressure, tightness, heaviness, squeezing, burning, or pain in the center of the chest. But heart attack symptoms are not always only in the chest. Pain can move to the left arm, both arms, neck, or jaw, or even to the back. Some people feel shortness of breath, sweating, nausea, dizziness, or extreme weakness during the heart attack. Women, older adults, and people with diabetes may sometimes have less typical symptoms. They may not present with chest pain. They may present just with back pain or shortness of breath. So the key message is this: if symptoms feel serious, new, or unusual, please do not wait. So, why does a heart attack happen? A coronary artery, which is the blood vessel carrying blood supply to the heart muscles, is like a pipe. Over many years, cholesterol plaque can build up on the walls of that pipe. One day, if the plaque cracks or rupture, a blood clot can form at that location. If the clot blocks the artery, the heart muscle beyond the blockage does not receive oxygen. This is heart attack. Now, Richard Rowe realized that something serious was happening to him. His wife was not at home. She had gone shopping. At that moment, the face of his deceased friend, Peter Doe, came before his eyes. He decided, I must not make the same mistake my friend made. He remembered watching a heart attack awareness video on social media earlier. So he immediately took a 325 milligram of aspirin tablet. He chewed it. He also called the ambulance right away. He knew that he should not drive himself to the hospital, and he was also aware that emergency teams can start evaluation and treatment quickly. So within 5 minutes, the ambulance arrived. The ambulance staff immediately checked his blood pressure and pulse and took an ECG. They identified it as a dangerous major heart attack from the ST elevation seen on the ECG. They immediately gave a nitroglycerin tablet under his tongue, and the chest pain began to decrease slightly. Immediately, the emergency team informed the nearby hospital that had angioplasty facilities and alerted them, saying the patient is on the way, be ready. They also transmitted the ECG to the emergency room physician. The hospital was only 10 minutes away. The hospital team immediately placed the cardiologist and cath lab team on standby. As soon as Richard Rowe arrived at the hospital emergency room, blood tests were performed. The blood test included troponin test, which are used to confirm a heart attack. An IV line was immediately started and an angiogram was performed in the cath lab. It was found that there was a 100% blockage in the LAD, which is also called the widowmaker artery, one of the most important blood vessels supplying the heart. Within 90 minutes of arriving at the hospital, the doctors performed angioplasty and placed a stent, completely clearing the blockage. An echocardiogram, which is the ultrasound of the heart, confirmed that there was no major damage to his heart muscle. For the next 24 to 48 hours, Richard Rowe was closely monitored. His heartbeat, blood pressure, oxygen level, symptoms, everything was monitored. Depending on the patient's condition, aspirin, clopidogrel or ticagrelor or Praluent, cholesterol medications, beta blocker and other heart medication may also be given. Richard Rowe got aspirin, Brilinta, a statin and a beta blocker. Preventing complications is extremely important during this period. Going home from the hospital is not the end of the story. It is the beginning of recovery. Medications must be taken properly. A healthy diet, safe exercise, blood pressure control, cholesterol control, diabetes management, smoking cessation, all are necessary. A stent opens up a blockage, but the stent itself does not remove the lifestyle factors and risk factors that caused the blockage to develop. Therefore, long-term prevention is extremely important. Richard Rowe still remembers Peter Doe to this day.